The nursing shortage emerged in 1998 and peaked in 2002. In the late 1990s, government funding and private payer reimbursements both declined, causing healthcare institutions to make budget cuts. Hospitals and other healthcare organizations downsized and cut nursing staff as a cost cutting initiative, which led to the severity of short staffing the nation is facing today. When the nursing shortage arose, nurses who were left at the bedside found working conditions unacceptable and left the profession. The current global shortage of RNs was predicted in the mid 1990s and declared critical in the current day and age by healthcare organizations such as the World Health Organization, International Council of Nurses, and Canadian Nurses Association. The nursing shortage began in the late 1980s, which was around the time when the women's rights movement was making strides. Feminism was prevalent, and more women were attending college, earning degrees, and working jobs in male dominated career fields. Nursing has predominantly been a woman's job, which dates back to the origin of nursing. In the 19th century, only males could join the military, so naturally females provided care to the soldiers on the battlefield, which eventually evolved into the idea of nursing. In the early to mid 20th century, sexism in the workforce was at large, and equal employment opportunity for women was unheard of. The few career opportunities for women included being a secretary, nurse, maid, or nanny. As more lucrative career options for women became available in the 80s, many women chose to do something other than nursing, which only further added to the nursing shortage. The current nursing workforce is aging and will eventually reach retirement. If the amount of nurses joining the profession doesn't equal the amount of nurses leaving the profession, the nursing shortage will only continue to grow. In the United States, the nursing workforce is predominantly over the age of 35, which can and will lead to issues because a majority of the workforce will all retire from the profession around the same time, thus increasing the nursing shortage. Additionally, the attrition of older nurses resulting from unsatisfactory work conditions may result in early retirement, which will leave healthcare institutions lacking older, experienced nurses to teach and train younger, inexperienced nurses. Various barriers to obtaining a nursing degree prevents people from pursuing a career in the nursing field. The main barrier preventing more students from becoming nurses is the public awareness of the competitiveness and difficulty into gaining entry in nursing programs. An increase in the enrollment of nursing students is needed but hard to achieve because of the nationwide shortage of academically qualified faculty available to teach in nursing schools. Nursing programs have competitive selection due to a limited number of nursing educators and clinical sites, which is often viewed as unattractive by students afraid of being rejected. Over 75,000 qualified student applicants to nursing programs in the United States alone are turned away each year because of a shortage of nurse faculty, clinical sites, and inadequate education budgets. The trend in the nursing shortage will continue if the increase in education capacity is not being met. Money is another barrier to education in that college tuition is very expensive, and when studying nursing, books and other education tools required are also very pricey. Many students simply cannot afford to attend nursing school. Nurses are essential in providing high quality care because of their close proximity to patients. A major consequence of current shortages in nursing is the erosion of the quality of care. Staffing an adequate amount of nurses is beneficial to healthcare settings because more nurses means better patient care. In a valuable study, the majority of registered nurses reported the shortage of nurses was a major problem for the overall quality of patient care. The nursing shortage has caused many healthcare institutions to have inadequate and unsafe staffing on a regular basis. Unsafe staffing creates chaos and inhibits nurses from taking the time to provide needed care for their patients. Understaffing results in nurses not having enough time to perform the level of patient care their patients deserve and prevents them from having the time to fully educate their patients on their individual care plan and the treatment they are receiving. Allocation of nursing time to patients presumably influence the quality and thoroughness of nursing acts and assessments. The shortened time nurses get to spend with their patients is detrimental to patient care. Time spent with patients gives nurses opportunities to identify signs and symptoms of complications that, if acted upon quickly, may prevent deterioration in the patient's condition and even death. The nursing shortage has negative impacts on patient safety. Nurses, due to their inadequate number, face more physical and mental demands during shift work, which leads to more errors in type, dosage, and frequency of medication. Also, a lack in nurses has resulted in nurses having less time for meticulous care, causing more patient complications such as falls, nosocomial infections, pressure ulcers, failure to rescue events, and even death. The shortage has caused nurses' individual workloads to drastically increase, which heightens the risk of experiencing an adverse patient event. The nursing shortage not only affects patient care but also affects nurses' overall job satisfaction. The shortage in nurses has forced several healthcare organizations to increase the workload of individual nurses and utilize mandatory overtime. Furthermore, unlike in other occupations, a nurse's compensation doesn't increase as they are required to assume greater responsibility, acquire more technical competence, and as their years of experience in the nursing field increases. It is easy to see how a nurse's job satisfaction would decrease within the shortage as their workload and overtime forcefully increased while their salary remains stagnant. The shortage has caused nurses to be responsible for the care of an unseemly large amount of patients at one time. Having a nurse take care of more patients than they are physically and mentally able to will lead to feelings of stress, anxiety, fatigue, and frustration. In the early 2000s, the top reasons for the nursing shortage, as described by nursing professionals, were as follows: salary and benefit issues, more career options for women, undesirable working hours, and a negative work environment. Lousy compensation, an unpleasant work environment, and having to work long hours on end obviously results in a decrease in nurses' job satisfaction and causes nurses to leave the profession. Hospitals and other healthcare institutions recruit recent nurse graduates by offering them sign-on bonuses or paying off their student loans. Sign-on bonuses involve a nurse receiving money for signing a contract stating that they will work for an employer for X amount of years. In attempts to gain more nurses, several healthcare settings will offer their certified nursing aides tuition reimbursement. Tuition reimbursement enables the nursing aide to earn a nursing degree for virtually free and that the employer will pay for the cost of tuition. Several healthcare settings heavily rely on offering competitive compensation as a way to quickly recruit nurses. Also, to retain the nurses they already have, many hospitals will increase nurses' salary as their years of experience increases. High salaries for nurses attracts more people to pursue a degree in nursing, thus effectively combating the nursing shortage. Various healthcare institutions have utilized flexible scheduling to obtain more nurses. Offering shorter shift options rather than just 12-hour shifts allows nurses to better balance between their work and home life. Also, having more options as to what days and times a nurse has to work allows nurses to choose a schedule that fits best with their busy lifestyle. Lastly, flexible scheduling gives nurses an increased feeling of personal control over their work environment. Another key strategy to recruit and retain nurses involves improving nurses' work environments. Initiatives to improve work environments for nurses include creating better break rooms, promoting cooperation between all nursing staff, and implementing career goal incentives. Some hospitals have even designed committees to solely work on brainstorming ways to better the nurses' work environment. All right, so Leah, how did you begin your career as a registered nurse?
Well, I went to mid. I did all my prereqs there and then got my associates through them. So I chose that path rather than like a university, that kind of thing, mainly for cost.
It's cheaper.
Yes, definitely for cost. It was a lot closer to home, and mid has a really good program. So they're definitely highly recognized compared to like a lot of even the universities. When we were doing clinicals at like St. Mary's and Saginaw and other places that like different universities like Saginaw Valley had students, it seemed like nurses, staff, management always wanted the associate's degree. Yes, because they're so much better like hands-on, and yeah, so I just thought that was a better stepping stone for me. But.
All right, great. So on average, how many patients would you say you're responsible for during a shift?
Well, we have a core staff of 3 at McLaren, and since I'm on the OB unit, we go by couplets. So mom and baby, I'm responsible for both of them. I prefer just to have one in like the labor setting, just because it's like those babies can go down so fast. Same with moms, and so it's a really crucial time. That I prefer to only have one in that case. But even like postpartum, when I'm doing that, I think the highest I've had for that is 4. So which is 8 patients, which is a ton. Uh-huh. Yeah. So some of those days, you know, you're not getting your charting caught up until like 6 o'clock at night, and your shift's done at 7:30. So it's really important to like take all your notes and that kind of stuff like throughout the whole shift. Yeah, so it can be like,
you're busy.
Yeah, like feast or famine in that floor for sure.
All right, great. So have you ever been mandated?
I luckily have not been mandated yet, but I know it's coming, especially like with bad weather and like bad roads and that kind of stuff. I was kind of the cause of a mandation this past fall. I hit a deer on my way to work.
That's understandable.
Yeah, so that was like a good excuse.
That's good. Yeah. Is your car okay?
Oh, my car was totaled. It was awful. Yeah. So that was one of the mandations that I like caused, which I felt really bad about, but it wasn't too bad.
Right.
For the other nurse that had to stay over. But I do know that a lot of my peers that I went to school with and stuff, like they're mandated all the time.
Yeah.
So especially like the med surg units and that kind of stuff. So it happens a lot.
All right, thanks. So what's the longest shift you have ever worked? And do you feel your quality of work decreases after you have worked for more than a consecutive 12 hours?
The longest shift I ever did was 16 hours. And I wasn't mandated over for that.
You just work a double?
It actually was like my normal shift, which is 7 to 7:30 p.m. So 12
Okay,
and
you
a
were
half
12s,
hours.
yep.
And I had a really sick baby who had to get transferred. And it was towards the end of the shift, so it was just kind of bad timing on that part of like getting all caught up with like the paperwork and that type of thing, and making sure that they left and everyone was on the same page, like communication wise and stuff. So that did take a lot longer than it normally should. But yeah, it was a long shift, and definitely like as the hours go on, like I feel just more like drained, especially like if it's your third on, you're like, oh my gosh, like I have to stay sharp, like especially like in any nursing field or like any aspect that you go in the different floors and stuff, but especially on like labor and delivery, yes, with that, like the babies, they crash so fast if they are like wishy-washy. So yeah, I drink a lot of coffee.
Great, that's good.
Yeah, so we just make it work.
That's a good answer. Does your employer have a required nurse-to-patient ratio?
I don't think it's in writing. I know like our med-surg units, they try to stay around like 5 or 6 per nurse, but it does go up like 7, 8, and that's when it starts getting like really unsafe. We don't have that on our unit, but if we do feel like we don't have the right staffing requirements for all of that stuff, we call in like our manager, our nurse supervisor, everything to like make it as safe as possible, but we don't have anything in writing.
Right, so you have policies, whether they're not all mandated all the time, but...
Right.
Okay.
Right.
Have you ever experienced short staffing?
All the time.
Sure.
It's really bad to work with, honestly. And like I said, in OB, like you can have no patients whatsoever, and then once we don't have any patients, our unit kind of shuts down. So we always have 2 nurses to stay on there in case someone comes in with like their water broken or trying to roll.
So you can get 6 admissions at once.
Exactly.
Yeah.
So like when that happens, and like say you already sent one of your nurses to a different floor or something like that, then you're scrambling. Like, now what do we do? So it's just finding that happy medium of like...
For sure.
Yeah.
You probably have a float nurse though too, right? Or a few? No, you don't have any floats?
No. So if we are super, super short staffed, we will pull, like after we call in all of our day shift, night shift, casual nurses, everything like that, and we still can't get anyone, we'll pull from our med-surg floors if they have any extra to spare. But they're not super familiar with that, so it's really hard to go from...
to train them.
Yeah, like all of just the regular like pulmonary problems or cardiac problems, that kind of stuff, to like these fresh newborn babies. That it's really hard to go back and forth.
Well, ICU is a lot different than OB, or OBS to OB. So I see the switch there would be tough.
It is.
So I know you talked about it a little bit, but any specific implications you've seen from short staffing?
Yeah, and it can be really scary too. Like I said, we're the most like targeted for like lawsuits and that kind of stuff, and we have had a few of those like through this past year of like not having the right amount of nurses present for maybe like a high-risk delivery or like to stay with the postpartum patients or something like that.
It puts you in a tough spot, doesn't it?
Yeah, and then like you want to be the best you can be, but there's only so much one nurse can do.
Right.
So when you are short-staffed, it's just like, okay, did I get all my check marks? Did I do all these things? Like we had one case that they didn't check the blood sugar in time, and that baby like tanked, and it was a big lawsuit, and it's scary.
That's tough.
It's really scary.
Last question for you today. How satisfied are you with your job as a nurse, and do you feel you're fairly compensated for your work?
I love my job. It's the hardest thing you'll ever love, and I wouldn't trade it for anything. I love what I do. Do I feel like I'm fairly compensated? Yes and no. it kind of stinks like when you get pulled away from your family for different holidays and that kind of stuff.
Right.
But like that's all a part of the job too.
Yeah.
Financially, I think that nurses do really well, especially in like this area, and even if you specialize in that kind of thing. But I wouldn't change any of it.
Yeah, great. I just know I've been researching nursing. Sometimes when you assume more responsibilities or you're asked to be more technically competent, you don't always increase with your wage, where in other occupations in the business field, as you assume more responsibility, you're promoted and you receive higher compensation.
Yeah,
so.
and like even like I have my associate's degree, working on my bachelor's here pretty soon. I only get 20 cents more an hour
when you have your bachelor's.
Yeah. So that's kind of frustrating.
Right.
Like the field is changing, and a lot of the employers are
requiring bachelor's too. Yeah, I mean, Michigan is.
Exactly. So you can't even get hired there unless you have your BSN, and all the nurses there, like they have, I think, 5 years to get it or something like that. Where the facility that I'm at right now, they don't require that, but I know they will in the future. So if I ever...
You're just getting ahead of the curve.
Exactly. So if I ever want to move or do something like that, I just want to be ready for it. But it does kind of stink that, like, you're not, I don't know.
I know what you mean. You don't want to bash it, but at the same time, it's tough.
Yeah.
All right. Well, thank you, Leah.
You're welcome.